Hello, this is Dr. Lewerenz at Longevity Health Institute in Rochester, Michigan. Coming at you from my office in suburban Detroit at the Beaumont Health and Wellness Center, the Longevity Health Institute. We do a lot of regenerative functional medicine, a lot of holistic medicine, a lot of integrative approaches where we integrate for your health Western and Eastern medicine, traditional and some alternative or complementary medicine, holistic medicine. And so this way our toolbox or the things, the benefits that we can help you with can be fully comprehended in that. So one of the things I like to do on these little short videos is share with you experiences I had in the office today, some patients, some interesting things that I even found were interesting for me, things that I don't necessarily see every day or every week, but maybe monthly or yearly. And a couple of these cases I thought I would share with you. And the first one is somebody that I have a lot of snowbirds, a lot of patients that go to Florida in the winter, go to Texas, Arizona, go to the South, California, Mexico for sometimes just a month or sometimes 4 or 5 months to get out of this Michigan lovely weather. Although today we're having gorgeous weather here for May. So the thing though is there was a little bit of lapse. I do a lot of concierge medicine too, where I treat people over the phone and do some consultation on that. But this patient didn't kind of come back to me. I knew they were going to Florida. We made a plan, and she has the thing that's interesting is she's 76 years old and doing lovely, doing great. She has a degenerative back and some disc issues and something called lumbar spinal stenosis, which give her a lot of back and arthritic and aches and pains, things like this with her back, cause some radiation in her legs, hips, things like this. And so she has some gait and walking issues. She also has gouty arthritis. She gets gout flares. Gout's very common. You may know somebody, you're familial, that has issues with gout. These are two big inflammatory processes that individuals can have. Arthritis is essentially inflammation, and gout is essentially an inflammatory response in the body. I'm making this simple so we're cutting to the chase. That is this. Hormones play a huge role in your anti-inflammatory response in your body. Huge. Hormones are huge for inflammation in your body. This lovely lady, again, that's 76, actually, we do hormone replacement on her. I give her a testosterone pellet in her hip for her hormone deficiencies. Testosterone is an excellent anti-inflammatory agent in the body. Excellent. And actually, it was helping her gout, helping her back. She was functioning well. Actually been golfing, things like this. But subcutaneous testosterone pellet injections last about 3-4 months, and eventually that pellet's going to time release and wear out. So she has been out now and out of the state and down in Florida for about 5 months, kind of prolonged her trip and her time down there, and now came in today and shared with me some things like, oh, hey doc, I had to go to the urgent care, I had a gout flare, had some questions, and I had to kind of reiterate and kind of bring her back full circle about the testosterone and hormonal effects. And basically after about 3-4 months, her back started flaring up, arthritis started getting worse, her gout uric acid level flared, and 100% linked to the fact that her testosterone pellet was wearing out and her hormones got a little imbalanced, her inflammatory markers went up, and thus she had a lot more aches and pains and couldn't even just do simple stuff like walking and getting out on a daily basis for exercise. And she is a golfer still, and said that, yeah, it was getting hard, I had to give up on golf, kind of complained about loading up the car to get back here to Michigan to travel. So something that's very important and something that I want to encourage even people that are advanced in age. You can still have optimal quality of life, you can still be highly functional, you can do it in a safe way, but that's balance your hormones. And testosterone, not has to be high, but when it's more balanced and used appropriately in an optimal range, you'll have less inflammation of your arthritis and less gouty arthritis and less aches and pains on a daily basis. So something that's a great take home about that and that she experienced. Now, she's coming back next week. We're going to give her a pellet. We were just doing some labs and a follow-up on her, and she'll be back in action in a couple weeks and not have a problem. So excellent case to kind of just, go over and share with you. Another one is a patient that actually has been with me for a few years for some things that are related to digestion and related to gut health and kind of just energy overall. He does pretty good in general and pretty healthy in his life. He's 59, but this is what happened with him. I could cheat here a second and look at this. But back in 2017, he actually had a small heart attack and ended up getting a stent. And, he's very concerned about that. He does have a little bit higher or elevated lipids. He does have hypertension, so he's got some risk factors here. And he has a cardiologist he works with. What we did is we looked at him, and as we're interviewing with him and going through, I did some heavy metal testing. And two things actually came back, and I think three things that are very important in this man's risk of cardiovascular disease, and you could actually say that he has early cardiac disease. No man in their 50s wants to have any cardiac events or blockages in arteries or these types of things. But he had something going on that was evident. We did heavy metal testing. Heavy metal testing is a urine test to look at heavy metal toxins like arsenic, mercury, tin, aluminum, lead. I could go on, because these are known to cause neurodegenerative things with our brain and cardiovascular events, clogging essentially in our arteries. Okay, and so this is very evident. There's studies on this. We see results here of this and that. He came back with a heavy metal test, and it's something that kind of make sure I'm not sharing his name and things, but that came back very high. And this kind of outlier here is actually tin. And he had another one that was slightly high, that was aluminum. So he had a higher levels of aluminum and tin. Tin was very high. And then he had this, what he felt, other than the blood pressure, a pretty unexplained, didn't really understand. He's lean, he's active, he works out in that cardiac event. And obviously he's wanting to get to the root cause so he doesn't go through this again. I'm surmising with him as we investigate today and talk about how we need to chelate and potentially get these heavy metals out of him to risk reduce him, okay? But he had, remember, he came to me, I think back in 2014, and we started working on digestive health. And his digestive health has been very good. He's, I think, healed his gut, symptomatically doing well. He's off some medications that were being used for his digestive health. But when we reviewed his history, after getting this test back, he told me today that he ate and had Tums like candy. He said he probably had, if he had 5, he probably had 20 some days of Tums. What is Tums? Tums are aluminum-based, tin-based, and have high levels of calcium, because basically those things act as buffers, will settle down your stomach and give you some good GI relief pretty quickly. And they're symptomatic treaters, Band-Aids, they don't fix you. I believe, and I surmise, that this is where he got his tin, his aluminum levels, and higher calcium. Calcium is a risk factor to lay down in your coronaries, make your arteries stiff. Okay, we think on one of our other videos here I shared with you about getting cardiovascular calcium scores. So this is very, very key with this gentleman. We're going to get this stuff out of him. We're going to chelate him, keep working on his health. He's doing very well. He feels good now. Blood pressure, many things are great. Okay, but this is very important. He started with a digestive issue, which creates inflammation. Inflammation is a big cardiovascular risk. Eating Tums, which is calcium, aluminum, tin, cardiac risk, neurodegenerative risk, essentially by band-aiding digestive stuff, and it probably took him years. It could have taken him 5, 10, 20 years. But this is what gave him a little bit of higher risk, if you will, or pre-advanced or pre-risk as far as a cardiovascular event and getting a small MI, but at any point in MI, and having to have a stent at 59 years old. So something that's, I think, excellent to share with you, with patients, share it with your loved ones and your friends and that. And then quickly, one last patient, and this is somebody that I just saw today as a new patient. Her mother actually recommended she come in because her mother's a patient. She's 20 years old, okay, college student, just finishing college at U of M, smart, young, beautiful, couple simple issues, that are typical, okay? but something that is, boom, evident to me, want to share it with you, and we see because she's a vegan. She's been a vegan for a number of years, okay? Vegan diets are excellent for you, but there's a few things you have to be aware of and you have to watch. You can get some nutrient deficiencies, some iron deficiency, B12 deficiency, some things that are very obvious. Now, obviously I started today, I don't have any testing back yet. We did some laboratory and we're looking at her like we do with everybody in a very detailed, personalized way. But one of her main complaints, besides acne and a little bit of fatigue, was she has chronic tongue ulcers and tongue pain and tongue sensitivity, okay? What I believe we're gonna find, because I looked at the striation in the villi and stuff in her tongue, and they're evident and look like B12 deficiency. I really believe we're going to find out she's B12 deficient. She's a vegan. Without supplementing this and checking B12 levels maybe once or twice a year, you can develop tongue pain or this type of ulceration of the tongue. Obviously, we'll fix this, get her gut, and make sure that's good. We'll get her B12 level up, even if we have to do injection or short-term infusion therapies of nutrients and that. But I believe we're going to find with this young lady that's very healthy, doing very well, but seen an allergist already, and actually seen a oral surgeon, and we're eliminating risks like autoimmunity that can cause some of this, and other nutrient issues and that, and food allergies and that. But B12 deficiencies significant because of her being vegan and not being, aware of this, could cause this tongue pain and tongue ulceration. So she'll be fixed. She'll do lovely, and she was a pleasure to see. So hopefully this enlightens you. Hopefully it's not too lengthy, but it gives you an idea of what we do here at Longevity Health Institute, how we fix people, how we work on regeneration and optimization, and share this with others. And we're happy to always help here. I've got 2 locations. You can look us up on the web, on Facebook, here in Michigan. And again, I hope this finds you well and educates you. This is Dr. Lewerenz from Longevity Health Institute. Be well.